Every 40 seconds, someone in America suffers a stroke. With May being National Stroke Awareness Month, we want to make sure that you know the warning signs of a stroke and how to act on those warning signs to make sure you receive the best care. Joining me today are two of our stroke experts in our Peter O'Donnell Jr. Brain Institute, Dr. Nneka Efejika and Dr. Erica Jones. Thank you both for being here. Dr. Jones, tell us what a stroke is and what are the types of strokes?
A stroke, in a broad sense, is just damage to a particular blood vessel in the brain. So it obstructs blood flow to a portion of the brain. So there are two major types that we like to categorize as ischemic stroke and hemorrhagic stroke. So the ischemic type means that there was a blockage of the blood vessel, and then the hemorrhagic type means that there was a rupture of the blood vessel leading to bleeding into the brain.
The perception of many people is strokes are something that happen only in older people. Tell us about who's at risk for stroke and what are the risk factors for stroke?
So the number one risk factor for stroke is hypertension. And we find that hypertension doesn't necessarily start in older people. It can start in the young. And uncontrolled hypertension is a substantial risk factor for cerebrovascular disease. Other conditions such as hyperlipidemia or high cholesterol, diabetes mellitus, and I like to say the number one risk factor for me is obesity, because obesity can tie into all three of the previous risk factors. So if you can help yourself by doing dietary management, if you can exercise at a young age, you can mitigate some of that stroke risk as you age.
Dr. Jones, what are the warning signs of a stroke?
Weakness on one side, so trouble using your arm or leg on one side of your body, trouble speaking, slurred speech, and trouble getting your words out. Facial droop, so seeing your face sort of look asymmetric or twisted. Trouble with your vision that comes on suddenly, and also trouble with balance and dizziness that come on suddenly are some of the most common symptoms of stroke.
Why is it important for you to act quickly, to get to an emergency department or call 911 quickly? What's the time pressure?
So we like to use the phrase time is brain. So when there's an obstruction of blood flow to a part of your brain, the brain cells start to die actually quite quickly. So it's really important that we try to initiate treatment as quickly as possible. The treatments that we have available for stroke are really the most effective right away. So the sooner you get to a hospital, the more likely you are to be eligible for treatment.
And what are those treatments like, Dr. Efejika? What actually happens when you receive one of these medicines or you receive a procedure for a stroke?
When you present to a hospital where you're able to receive thrombolysis, they take you to the CT scanner right away to make sure you don't have a bleed in your brain. After that, they can start either, if we receive TPA, they can start the bolus and the infusion, which goes over an hour, or they can give tenecteplase, which is actually one shot that they can give to you right there in the emergency department. As you're stabilized, they move you upstairs, and if you are a candidate, you're able to go to the angio suite and actually have the clot removed. They usually do a groin puncture, thread a catheter up to your brain, and are able to physically remove the clot if there's one visualized. And if that happens, we really see a very significant improvement in your outcomes after you receive this kind of intervention. It's really important to note that for every minute that passes, you lose about 1.9 million neurons. And so indeed, it's critically important to present to the hospital as soon as possible for either one of these interventions.
What's the difference between what's taking place now and what was taking place 5 or 10 years ago in terms of recovery from stroke?
It has become much more evidence-based and much more intense. We start stroke rehabilitation within the ICU. So my consults come usually on day one, because we need to have a plan of strategy for recovery after acute interventions. And so we also want to start therapies. A part of my job is actually mitigating healthcare related complications that can preclude them from receiving the intensive rehabilitation that they need.
Dr. Jones, UT Southwestern and researchers at Johns Hopkins have found a link between neurodegenerative diseases after a stroke. Tell us a little bit about the research in that area and what promise it holds.
There's some really exciting research there coming from Dr. Yingfei Wang's group concerning AIF3, so apoptosis-inducing factor 3. This is a protein that they've identified both in human and mice who've had stroke. This particular protein is associated with neurodegenerative process. So This is something that we see in stroke patients, that many of them do go on to develop dementia and can have progressive loss of memory and cognitive ability. And so if this is a protein that is involved in that process, then this could be a potential target for future therapies to try to curtail some of that progression of cognitive loss in our stroke patients, which would be very exciting for their rehab and recovery.
Dr. Fejka, what is your group working on in terms of research into stroke recovery?
We've been working specifically on the transitions of care after stroke. And so we found that in some patients who are transitioning from the hospital to inpatient rehab or the hospital to outpatient therapy, things are getting missed, and that actually increases their risk of having preventable readmissions to the hospital within 30 days. And so what we've done over the past 3 years is actually create a stroke continuum of care where we have virtual rounding tools. We have the ability to perform opportunity assessments for barriers to discharge, and we're able to start additional stroke rehabilitation research within the acute care setting, transitioning over into the inpatient rehabilitation setting. So it's an opportunity to specifically decrease the burden of post-stroke complications, as well as improve access to stroke rehabilitation in the acute care and post-acute settings.
What does the future hold for stroke care?
The big changes are in improving access to acute care. So there are some exciting things happening with mobile stroke units and trying to expand access to the mechanical thrombectomy so that more people actually have access to those therapies. I think that's the big direction that we're going in for acute care. And then also in stroke recoveries, there's some interesting trials with stem cell research and trying to come up with ways to prevent some of the long-term disability from stroke. So those are things I hope to see more of in the future.
Well, I want to thank you both for joining us today and for this important information about stroke as we raise awareness about stroke during the month of May and look to improve the health of our community.
Thank you so much
Thank
for having
you.
me.
Thank you for joining us. Until next episode, stay safe and stay healthy.